Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Norovirus stomach bug versus food poisoning. It can be hard to tell the difference between norovirus, the most common cause of stomach flu, and food poisoning because both cause nausea, vomiting, and stomach pain. /r/n/r/n A few signs can differentiate the two, including when symptoms start and how long they last. With food poisoning, symptoms often start sooner than with the stomach bug, sometimes within minutes of eating contaminated food. Norovirus symptoms can take anywhere from 12 to 48 hours to develop. /r/n/r/n While there are many overlapping gastrointestinal, GI, symptoms between norovirus and food poisoning, they are caused by different things. A virus causes norovirus, and food poisoning can have several different causes, ranging from bacteria to parasites to viruses. /r/n/r/nVerywell, Joules Garciarnrn Some of the symptoms of food poisoning are the same as symptoms of norovirus, so it can be difficult to tell the difference based on symptoms alone. /r/n/r/n Here is how the two illnesses compare side by side. /r/n/r/n nausea /r/n/r/n vomiting /r/n/r/n stomach pain /r/n/r/n cramping /r/n/r/n weakness /r/n/r/n may be watery, bloody, or mucus-like /r/n/r/n fever /r/n/r/n nausea /r/n/r/n vomiting /r/n/r/n stomach pain /r/n/r/n cramping /r/n/r/n weakness /r/n/r/n typically watery /r/n/r/n fever /r/n/r/n chills /r/n/r/n headache /r/n/r/n muscle aches /r/n/r/n. In a nutshell, food poisoning and norovirus both cause severe gastrointestinal symptoms, but norovirus, like most communicable viral diseases, typically leads to flu-like symptoms. /r/n/r/n On the other hand, food poisoning is more likely to cause severe gastrointestinal symptoms such as projectile vomiting and bloody stools. Food poisoning and norovirus can cause gastroenteritis, irritation and inflammation of the stomach and intestines. /r/n/r/n Most people recover from food poisoning in 12 to 24 hours. However, people with the stomach flu or norovirus may take longer, with symptoms sometimes persisting for more than a week. /r/n/r/n The biggest difference between food poisoning and norovirus is when symptoms begin. Food poisoning causes symptoms sooner than the stomach bug. This is explained by how both diseases work. /r/n/r/n Signs and symptoms of food poisoning usually begin 30 minutes to 8 hours after eating contaminated food. However, some pathogens may take longer for symptoms to develop. Signs of stomach flu, norovirus, typically start 12 to 48 hours after exposure to the virus. /r/n/r/n Not only are the organisms that cause food poisoning and stomach flu different, but so are some of the ways they are spread. /r/n/r/n Food poisoning is caused by eating something that is contaminated with germs, also known as a foodborne illness. This usually involves bacteria like E. coli, Escherichia coli, Staphylococcus aureus, or Salmonella, but here are viruses or parasites that can also cause food poisoning. If the food is not cooked, the germs can be passed to someone who eats the food. /r/n/r/n The contamination can occur at several points, including /r/n/r/n Norovirus is the predominant cause of stomach flu in adults, while rotavirus is the most common cause in children. Other viruses, bacteria, or parasites can also cause other cases of stomach flu. /r/n/r/n with norovirus, the transmission route is broader because the virus tends to be more challenging to neutralize on surfaces than foodborne bacteria. /r/n/r/n norovirus is commonly spread through /r/n/r/n depending on the conditions. Norovirus can live on surfaces for days to several weeks. It is also incredibly challenging to disinfect. Additionally, individuals who have had norovirus can remain infectious for up to 2 weeks after their symptoms have resolved. /r/n/r/n This is why it is essential to properly disinfect surfaces during and after suspected norovirus exposure and practice diligent hand hygiene. /r/n/r/n In the United States, an estimated 48 million people get food poisoning, and up to 21 million get norovirus each year. Combined, they are responsible for tens of thousands of emergency room visits and hospitalizations annually. /r/n/r/n The diagnosis of food poisoning and norovirus is more or less the same, and many of the tools used for the diagnosis, such as stool cultures, check for both bacterial and viral causes. /r/n/r/n If you are suspected of having food poisoning or norovirus, the diagnosis will typically involve /r/n/r/n Testing is especially relevant if there is a community outbreak, such as an outbreak on a cruise ship or in a hospital. At other times, testing can help trace the source of food contamination. /r/n/r/n On an individual level, the differentiation won't inherently alter how either disease is treated. /r/n/r/n With that said, the differentiation may be essential for those who are at high risk of complications, including /r/n/r/n The treatment of food poisoning and the stomach flu are similar. Generally speaking, antibiotics, used for bacterial infections, and antivirals, used for viral infections, are of little help once symptoms start. In some cases, they can make things worse. /r/n/r/n For most people, treatment can be delivered at home and may include /r/n/r/n Food poisoning generally isn't contagious from person to person in the way that the stomach flu is. Because the modes of transmission are different, there are different precautions you may need to take to avoid getting or spreading these diseases. /r/n/r/n To prevent food poisoning, you should as a general rule, /r/n/r/n To prevent the spread of norovirus while someone in your home is sick, /r/n/r/n If you have symptoms of food poisoning or norovirus, stay home and away from others until your symptoms have completely cleared. /r/n/r/n There are times when you need more than home-based care if you have food poisoning or stomach flu. It's important to know the signs to prevent potentially serious complications like severe dehydration. /r/n/r/n If you have food poisoning, seek immediate medical care if you have /r/n/r/n If you have norovirus, seek immediate medical care if you have /r/n/r/n Dehydration is common if vomiting or diarrhea persists for more than 24 hours and can quickly turn deadly if left untreated. /r/n/r/n Symptoms of dehydration include /r/n/r/n Food poisoning and the stomach flu can come with similar symptoms, like nausea and vomiting, but they're different conditions. Food poisoning is caused by food that's contaminated by bacteria, viruses, parasites, or toxins. The stomach flu is usually caused by norovirus. /r/n/r/n Both can typically be treated at home with hydration, over-the-counter medications for symptom relief, and rest. Protect yourself, your loved ones, and your community by practicing good hygiene habits and ensuring foods are prepared and served safely. /r/n/r/n. If you develop either condition, watch for signs of dehydration. See a healthcare provider if you have a weak immune system, are pregnant or elderly, or you have severe or lingering symptoms. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.